Hi everybody. This introduction is about 20 seconds long, which means this is a perfect time for you to wash your hands. This is a podcast where real doctors discuss fake medical emergencies, which means that unless your hospital's administrative staff has an a cappella band, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor after washing your hands.
Hi, everybody. I'm Jackson Bay.
I'm Johnny Kolasinski. You might remember me from such podcasts as Socially Distanced Distortion, a look at quarantine procedures in punk bands in the 1990s.
Oh, that's a good one. That's a good one.
This is Hi Everybody, a Bad Medicine podcast. Every week, well, almost every week, we talk about what Hollywood gets right and wrong about medicine and how the body works. And this week, we are coming to you from two different locations because we are socially isolating as much as possible.
Socially distancing as much as possible to keep this huge thing under wraps. I mean, we're recording from California, so we actually got a stay-in-place order from the governor.
Yep.
Not to go anywhere for the next, 2 weeks at least?
I really don't know. Katie and I, my wife, were doing it anyway except for work, and you and I and Katie, we all still have to go into work. You obviously are a doctor.
Yeah.
They're kind of important right now.
Working in the ER where we are running low on stuff, mainly personal protective equipment. So that's real fun. So nothing makes me happier when I walk out into public and see people wearing masks and stuff that doctors should be wearing or nurses should be wearing. But not only that, but wearing it really inappropriately too, like not fully protecting their face. Because if you wear one of those masks correctly, you will not be able to breathe after about 10 to 15 minutes.
Well, but then they feel like they're doing it wrong, so obviously.
Now, you wanna make it so hard to breathe that no germs can get in. That's how you know. But we should be talking about actually this week's episode does fit with what what we're all going through right now.
Yeah.
But before that, you want to plug some social media stuff?
So you can find this podcast online at hieverybodymd.com or on Facebook, Twitter, and occasionally Instagram at hieverybodymd.
We'll try to be better about that. Or you can also call us on our hotline at 530-DOCTOR. The B this week stands for good, bargaining, I guess, because it'll be one of the 5 stages of grief we'll talk about. So we should plug that people should try to continue writing reviews on Apple Podcasts and giving ratings on there too, because apparently we hit a big milestone where we actually made a chart.
Yeah, we've been we're doing pretty well. We're one of the top 250 podcasts in TV and film on Chartable, so that's pretty cool. This week is going to be a little lower because it took us some time to record. Also, apologies for the less than stellar recording. We'll keep working on making it better.
Yeah, there were a lot of kinks to get out of this episode, but we'll get through it. We'll still provide the same crappy content that we usually.
Yeah, the content's just as awful, but now the audio quality matches.
So speaking of content, this week's episode is what?
This week we are talking about Scrubs again, the episode My Cabbage, which is season 5. I want to say episode 17, did we say?
Episode 12 and 13.
Episode 12 and 13.
Yep.
Which you add them up and subtract some numbers, adds up to 17. My Cabbage, and what was the name of the second episode? Because I forget.
It was My 5 Stages.
My 5 Stages, as in 5 stages of grief. So, Jackson, you picked out just My Cabbage when we were talking about doing it this week, and why is that?
Well, it does kind of touch on why we're doing all of this social distancing and why we're sitting in 2 distinctly different places in San Diego right now. But kind of the premise is Cabbage, the Cabbage in the My Cabbage is referencing to an intern that JD really likes.
Mm-hmm.
He is terrible. He's probably one of the worst doctors that I've seen work there since the one that ended up becoming a pathologist because he killed so many people.
Yeah, that's the one who ended up in the morgue. Was that Doug?
Murphy or something like that. I forgot the name. But yeah, he ended up working in the morgue as a pathologist because he killed so many people. He recognized causes of death in patients or what sickness they had that led them to doing that. So yeah.
So I guess the big thing that drew you to it was one of the first scenes when we had the crow in the hospital, Sanchez, who that leads to Dr. Kelso in a rare moment of being a good doctor talking about how contagion spreads in a hospital.
Yeah, and Dr. Kelso, for all intents and purposes, is a good doctor, but he has to think about the business side all the time, which is weird for a chief medical person, no, chief of medicine to think about, because usually that's like a chief medical officer or CEO to think about.
Mm-hmm. And we've talked about that before.
Yeah, and Dr. Kelso does a lot considering how bad he has to be, and he realizes he has to be the bad guy and ultimately dumps it on someone else, basically. But he does show how it's kind of a nice way how they show infections are spread. So someone sneezes and then it turns into a handshake and it's just transmitted through these green kind of like glows, I guess.
Using the height of 2003 CGI.
I mean, they did something like this in Mythbusters too, where they had, I think Adam had a drippy nose the whole time and was just wiping it. But that drippy nose was clear until they turned on the black light, and that's pretty much what it looked like, was everyone was green. Mm-hmm. And they showed that he sneezed, there was handshakes, touching of a shoulder, and then the Todd walks in talking about his like wild night in Chinatown and just had green all over the place.
Yeah.
It was just like on his nose, on his mouth, on his like genital region. I mean, it spreads and it stays there for a little bit. But I guess when it drives to later in the episode, it shows that the bird never got kind of, I guess, they would never really remove the bird.
Mm-hmm. The janitor set him free.
The janitor did set him free after having him play dead and let Kelso poke him in the eye, and he didn't move. But one of the gloves in the hospital had germs on it. And then the Cabbage, the bad intern, picks it up, throws it into the hazard bin, doesn't wash his hands, touches the good patient, telling her like how much he liked her as a patient. Then she touches her face, and then she dies.
Right.
Which is kind of drives home the point of don't touch your face.
Yeah.
Because I think that's like one of the big things that keep on driving home, right? Is don't touch your face.
Yeah.
Even though.
I actually, you haven't seen me other than on Skype. I didn't shave my beard because I knew that I would be touching my face even more if I did, but I trimmed it down to as short as possible.
To be fair, if you washed your hands really well before you touched your face, you can touch your face. Mm-hmm. But that lady straight up shook the hand and then just put her hands on her face, kind of like almost like she was breathing him in. Mm-hmm. And then she got infected too. So yeah, don't touch your face right now unless you wash your hands really well, or at least use hand sanitizer for a while. And that was like the big thing about this whole episode, is just showing how easily it is for diseases to spread, even throughout a whole hospital where you think everyone would be clean and whatnot, where in reality, the hospital is the best place to get sick.
Right. And that's one of the reasons that like my understanding, it's one of the reasons we have the shelter-in-place order is not just to keep people from getting infected with COVID-19, but if everybody's staying home, hopefully they're not getting into bar fights and car crashes and falling and breaking their knee on rollerblades.
Yeah, like don't be like my patient like a few days ago who went to a huge party with hundreds of people and then ended up in the ER because they were worried they got the virus.
Yeah. Which means that, even if they didn't get the virus, they could have been exposed to something else hanging out in the ER for 4 hours.
Yeah, I mean, and we try our best to separate everyone. I don't know if anyone listening to this has gone, well, probably a good number of people have gone to the ER recently, but now we're all triaging people before they even walk into our waiting room. Mm-hmm. Because, like, if you're not that sick, we try to shove you or shunt you towards a nicer, or not a nicer, but an area where there aren't a bunch of sniffly, drooly people, but instead, like, you're just around not as contagiously ill people. Like, it's much more of an ordeal now than it's ever been, at least in my years of practice. I've never seen this before.
What's your opinion of Cabbage? Would you rather have a technically incompetent intern, or would you rather have the resident?
Oh, God. Honestly, I can teach a technically incompetent intern. I can't break a cocky intern. It's really hard. Like, it's one of those things where sometimes those people who are really just bad interns, you can try to teach them and try to change their habits a little bit. And that was like the next thing I was going to bring up was like, Cabbage did a lot of weird stuff that I would not expect a doctor to do. Like, put a bunch of candy around a bunch of suppositories. That was bad.
Not medical advice, but...
But, like, he put a Mike Ikes up someone's butt instead of a suppository, and you would think that should be common sense not to put a bunch of round pill-shaped candy next to something that's going to go up someone's rectum. And JD says it caused someone septic shock because of it. It's really hard to get septic shock from Mike Ikes.
Okay.
Unless it was, like, in someone else's mouth or butt first, and then you put it in someone else's butt. With a tear that's immunocompromised, it's really hard.
What about like a Sour Patch Kid?
Ooh, that's gonna burn.
Yeah, more likely.
Or a hot tamale. Gotta remember, those hot tamales can really hurt too.
Hot tamales aren't that bad though.
Yeah, because they got that coating outside, but once you bite through it, the cinnamon kind of burns. I mean, I eat a lot of spicy food, and cinnamon burn is different from like spicy burn.
I'm just fine with cinnamon burn, and this is the content people are subscribing for, by the way. But it's the hot, like, spicy that gets to me.
Oh my god, this is gonna be a painful morning.
Yes.
Yeah. But back to Cabbage, they also mentioned that he was really bad at reading x-rays. Mm-hmm. He read one of the x-rays backwards.
I laughed out loud there.
Well, I mean, it is a callback to their intro, or their credits, opening credits, which are always backwards. But that actually does happen in real life. I had one patient that I thought had dextrocardia, which means the heart is on the right side instead of on the left side. And I was freaked out. And then eventually the radiologist called and said, oh, they accidentally put it backwards. And I said, can you just get a repeat x-ray just to make sure? Because I don't trust anybody right now. I'm not sure if that heart's on the right side.
So, how nowadays are they still printing out the X-rays and not?
No, that's right. There are certain hospitals that still print out their X-rays, and I hate that because I can't zoom in and look at stuff. Mm-hmm. For the most part, they're all computer because you can do a lot more things with images on the computer, like zoom in, invert them. You can kind of change the contrast to make things kind of pop out a lot more. So a lot of times when I do get printed films, it's either patients from Mexico who went to TJ to get their care, or like hospitals in the middle of nowhere that still use printed x-rays. Okay. Or CTs.
And what is it? Dextrocardia, you said, right?
Yeah, so dextro means right, cardia means heart, so right-sided heart.
Is it generally just the heart that's on the other side, or would it be an entire inverse flipping of all of your goodies?
Well, sometimes you can actually have something called situs inversus, which means your whole body's flipped. So organs that should be on the right side are on the left side and vice versa.
I think that'd be more common. Not
really. Like usually with dextrocardia, or sorry, situs inversus have other issues too, like some kind of chromosomal abnormality. And it's common ones like something called Cartaginer syndrome, which is just me digging through my med school knowledge. And I've only seen maybe 5 cases of it in my entire time as a doctor.
Okay.
But it's a rare thing, but it's kind of funny. Cause they'll trick you. You'll listen to their heart. I remembered I had one patient who had something called SVT where their heart rate was in the 200s and started an IV in the arm closest to their heart. So, you know, standard person, I would start the IV in their left arm or have someone start an IV in their left arm. And then after we pushed the medication, the reason why we started in the left side or in the side closest to the heart is the medicine has a half-life of seconds. So the minute you push it in, it's pretty much breaking down already.
So you want to get it to the heart and then moving around the rest of the body as soon as possible.
Yeah. So we didn't know that the kid had dextrocardia. So we put it in left arm and we pushed it really hard. Didn't work the first time. So then the mom just goes, oh yeah, his heart's on the wrong side. I'm like, come on. That sucks. So then we gave a double dose and it actually worked anyways. But we were really frustrated because The worst part was the nurse was starting the IV in the right arm, and I said, "Hey, you guys, this is SVT. Where should we start the line?" And they go, "Oh, you're right, the left arm."
Ah.
And I sounded a total jackass because I corrected a correct thing.
Right.
Yeah.
Were the nurses aware of the?
No.
Okay.
They forgot. They didn't realize it too. And then when they said dextrocardia, we all just looked at each other going, "Ah,
What
damn
are the
it."
odds?
Yeah. The one time the nurse started on the right side was the correct side. So it was made me feel pretty bad that I corrected them, but also, it's all right.
Yeah.
Yeah. I was going to mention one other thing was JD asking Dr. Cox for a pen. People in the medical field can definitely appreciate this one, mainly because pens are one of the most valuable commodities in medicine.
Okay.
They get stolen a lot.
So if I ever go to the ER for something that's not a contagious issue, I should take a case of pens to be the favorite.
Oh, you'd be pretty happy. We'd be pretty happy because like everyone's going, "Do you have a pen?" "Oh, I had the pen right here." "Oh, it's gone now." And then it's always looking for a pen. So seeing JD holding Dr. Cox's pen, and Dr. Cox says, "Don't lose my pen," and then who is it? Sanchez? Is that the
Yep.
pen? Like, oh God, I know that feeling. Because then you have to give your pen back to the attending or someone higher up than you, and you can't find it. Horrible feeling. Because pens disappear by the end of the shift. No matter how hard you try to hang on to your pen, it will be gone by the end of your shift.
That makes sense to me, having waited tables for years.
Yeah, they just go away. You don't know where they go. People steal them.
Mm-hmm.
For you, at least, you know people are like signing bills and whatnot. We don't know where ours go. Like, it just vanishes.
So what I'm hearing is we should do the Ass Pen episode of Scrubs at some point.
Oh, yeah. The ass pen and the ass ring?
Yep.
Yeah. Those two go together hand in hand.
Butt and butt.
Oh, come on.
They go together like a mouth and an anus and human centipede.
Oh, they go together so well. But that's more like mouth to tailbone.
Yeah.
Remember, it wasn't quite ass to mouth at all.
Nope.
But this is and then I wrote something down. I'm trying to remember why I wrote this down. Remediation of interns versus,
Oh, because he was looking for a reason to suspend an intern.
Yeah, and interns usually aren't so much fired, they're more remediated, which means, let's say they had a hard time through certain rotations, they have to redo those rotations. So, like, you still can fail residency.
Mm-hmm.
So if you got, like, a bad grade in residency, they'll make you redo a part of the residency.
How frequently does that happen?
It's rare, because it's, like, really crappy for you to start with one class and then graduate halfway, like, after your class graduated.
Mm-hmm.
You know, unless it's like you got pregnant or you had maternity leave or paternity leave. That's really the only other reasons why you would graduate after your class. But graduating after your class because you suck is a terrible thing.
So what I'm hearing is if you're having a really, really, really rough time in your residency, that might be a good time to get knocked up or knock somebody up.
Correct, because then you get to leave that 1 month or month and a half to 2 months rotation and not have to worry about it. But you do have to make it up later.
Okay.
And I know that happened with a few classes that I know of. Not just like, I think in residency and fellowship, not so much in my fellowship itself, but like I knew of many people, actually a good handful of people that got held back like a month or two because they were not.
Oh, okay. I thought you were going to say that babies happened.
Well, babies happened too, like in my class, babies happened. But also I know of other people in my residency program and in other programs and places I've trained at where people got held back. And it's really obvious too.
What about the other issue that we saw with Keith and JD of your he's the fellow, right? JD
Who?
is?
No, he's an attending.
The attending. Your attending just really doesn't like you.
I had that happen.
Okay.
Yeah. I had one attending who basically told me because of where I came from that I was a lazy doctor, even though he never saw me work before. Mm-hmm. Said I was a lazy doctor, didn't want to work. avoided work, and this was my first day, and I haven't done anything yet. But it was solely based on where I came from for training.
Yeah, I was going to ask, is that where you came from in California, where you came from
California.
as a descendant, or where you came from as your med school?
Oh, no, just from my residency, because we were rotating at another hospital, and he basically told me all this stuff that I was just lazy and horrible, and I was always treated as like the dumb resident the whole entire month. Even though I was answering questions right on rounds, I worked really hard and all that stuff. It wasn't until at the end of the month when he actually acknowledged that I was actually an okay doctor. Not a good doctor, mind you, because I wasn't one of his residents, but I was an okay doctor.
Which is why one of the drinks at your wedding was the okay doctor.
Exactly. And the funny part was he actually said, well, if you had been a resident at my hospital, you would have been a great doctor. And I said, do I want to work at a place with you because you treated me like crap? I think I'd rather work at a different place and be happier.
So that's what a real Dr. Cox type relationships would be like.
Except I don't respect him.
Ah.
It's a big difference. Like, I don't respect him. Like, other people might. I didn't because I got treated so crappily that I wasn't looking for his approval. You know? My whole thing was, let me finish this month so I can get out of here. Work with people that actually appreciate my, like, you know, my I don't know what to say. My moxie, my enthusiasm. I'd rather work where someone would appreciate me rather than work somewhere where someone was always constantly putting me down.
Mm-hmm.
And that was the situation. But also, it's kind of frowned upon too what Elliot did with Keith, and that's the whole reason why JD had an issue with Keith, right?
Because Elliot was sleeping with
Keith,
right?
Which is a no-no.
Yeah.
Like
a couple of episodes later, we see the opposite of Elliot playing favorites to Keith.
Yes, because she treats him like crap because they're hooking up.
Mm-hmm. And then it turns around and she starts giving him all the good cases and things like that.
And that's like the worst thing. Like, I think that's like a big, and people talk.
Mm-hmm.
So like, word will spread really quick amongst their classmates and whatnot. No one's going to respect Keith. Like, it's a pretty crappy situation that Keith is in, too. Because Elliot basically made him the favorite, and then Keith now has to face it with all of his classmates. And his classmates aren't going to respect that, so that kind of sucks. So yeah, bad. That's almost like the closest thing to Grey's Anatomy they've done.
Yeah.
Like season 8, where Denise hooks up with the other surgical resident a lot.
I don't even remember who Denise is.
Denise is Joe.
Is Joe?
Eliza Coop.
Okay.
You should watch season 8. It's good.
Yeah, it's been out.
It's the last season that
It's the last good season.
Correct, before the car wreck that is med school.
Yeah. I'm rewatching it now, but I had not gotten to My Cabbage before we decided to record it.
But My Cabbage is a good episode,
yes,
man. Because it shows how it's like when you do have a bad resident that you have to pick up the slack for, especially as an attending. Sometimes attendings will fall into a trap where like, oh, I trust all my residents. They're all going to do a good job. Where it only takes one really bad one to make you double guess or double think, second guess everybody just to make sure that it's all right. And that makes it really hard as an attending that you're supervising, and they're your eyes and ears. And unfortunately, if you're half deaf because one of them is really bad, you can't do your job to the full capacity.
Right.
And it makes it hard because like residents will take a small portion of your caseload, but ultimately you're responsible for every single patient.
Mm-hmm.
Seeing a resident like Cabbage reminds me of some of my less than stellar residents that I have to pick up the slack for. And it hits home pretty hard. Moving on to the second episode, it's my 5 stages. So Mrs. Wilk, who was the favorite character, ultimately gets sick, and it looks like she got an incurable infection of some sort.
Yeah.
I'm confused.
Right. That was kind of my first question was, they brought in kind of a palliative care doctor, kind of just a grief counselor.
Yeah.
Huh?
He was more like a psychiatrist.
Yeah.
Yeah.
And they they brought him in, but she was just dealing with I say as we're dealing with a viral
Yeah.
issue right now, but she was dealing with a bacterial or viral infection
Yeah.
because it was something that was spread,
Mhm.
and she was awake, coherent. I didn't see any real like equipment that was acting as life support, but they were saying, yeah, you're dying, you're gonna
Yeah.
die, and you're gonna die soon.
I know, and that was weird because just because you're on palliative care, which I think Greg can explain this best, just because you're on palliative care or hospice care doesn't mean we gave up.
Mm-hmm.
You know, we still have to do things that'll make you comfortable. Be it starting antibiotics if we need to, if it's a treatable infection, giving you oxygen, giving you morphine, controlling pain. It's really to help whatever you're going through be more comfortable. And it almost seemed like they just gave up and didn't do anything. They just put some oxygen on her face, hooked her up to the monitors, and said, "Okay, here you go."
Yeah.
And she looked pretty good for someone who they said is going to die right away.
Mm-hmm.
Like I would expect her to have like some kind of symptom to prompt them bringing her back in, right?
Yeah.
She had nothing at all.
Other than whatever it was. I mean, the only thing I can think of would be whatever it was that she was in there for the first place left her so immunocompromised. But then I assume that they would still be doing more than just tossing an oxygen mask on her and.
Yeah, they basically just said like, "Oh, she's a multi-organ failure," and then they just let her be and let her die. And usually that can be kind of painful, you know.
Mm-hmm.
Your organs shutting down, you're not getting flow, you're basically in septic shock, you have fever, you're going to get air hungry because if your lungs are failing, you're not breathing super well. So like all those together, the fact that she didn't have an IV to give her medications, that was kind of mean on their point.
Mm-hmm.
So that was a little off. I didn't think that was super accurate on what they did. But then the other thing that I noticed too was they have her hooked up onto the monitor, and when she started to die, like she just kind of went from a normal heart rate to asystole. Like
Mm-hmm.
that's not how it happens though. A lot of the time, I've seen patients kind of go and die before in my career, and usually the heart rate slows down because the heart gets more tired. And then you go into something called PEA, which is like pulseless electrical activity. So you'll still see beats on the monitor, but the heart's not working.
Yeah, I think we've talked about that before too.
Yeah. And then it goes into like sometimes before that it'll go into a weird rhythm, but then you go into PEA and then eventually the heart kind of just makes maybe one beat every minute. So you actually see like a heart rate of 1. And then eventually it just stops completely. And it can also be just electrical activity firing, but the heart's not moving at all. So it's never that clear cut where they go from beep, 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 and then just a flat line. It takes a while, and the cardiac rhythm looks very sick, I guess is the easiest way to describe it. Because it does. It just looks like the heart's tired out. It's done. It's just slow. The volume's getting slowly turned down instead of a switch turned off.
Mm-hmm.
That's way to think about it. Yeah. But that episode, I mean, the first episode, My Cabbage, I appreciated it more than My 5 Stages.
Okay. That one felt more.
That one felt more like dramatic for the sake of being dramatic more than anything.
Okay.
Yeah.
Yeah, I didn't have. I mean, to me, it was a good episode of Scrubs, but it didn't seem like a intensely medical episode of Scrubs.
For a comedy, it was intensely dramatic.
Uh-huh.
At least for that episode. Compared to like My Cabbage, where there's a lot of hijinks and whatnot, this one had very low hijinks. And that makes sense because it was the second part of a 2-parter. And this one definitely had more of the emotional weight than anything.
Was this the first time we saw a to be continued on Scrubs? I know we're not going to be able to answer that accurately one way or the other, but I can't think of another one.
There are more later on.
Okay.
Like the one that I can think of right off the bat is on season 8, where the janitor goes to the Bahamas to get married. Very low on medical on that one, but that one definitely is a 2-parter. I don't know why I knew that right off the bat, but that's all. I've watched a lot of Scrubs in my career. But yeah. So yeah.
Well, I guess from there we're gonna go on to most important question.
Okay.
Which is, well, and we'll treat them as a whole at first.
You want to do one? You want me to grade it both of them?
Yeah, we'll do it as no. Let's do one-on-one.
Okay.
So people have time. They can
Yeah.
listen a little longer. So the first question I have is that the human centipede bills itself as 100% medically accurate.
Yeah.
If that's the case, how medically accurate is Scrubs Season 5, Episode 12, My Cabbage?
Okay. So the transmission of germs and all that stuff is super important, pretty accurate there because it goes pretty quick. The pen commentary, I know that's not medicine, but hospital life-wise, super true. I mean, it's fairly accurate. I will say it is more accurate than the human centipede. We need to start on our website just ranking where our accuracies are, so I can go to that and figure out where exactly it's compared to other things. That might be the quarantine project. I would say it's probably about 140, 150.
All right.
It's definitely more. I mean, it's 1.5 times more accurate than the human centipede.
All right. What about episode 13, My 5 Stages?
This one's a little tougher. I mean, in terms of the grief and stuff like that, I mean, those are well documented kind of stages of grief, the denial, anger, bargaining, grief, acceptance. I don't see people exactly go through those stages. People just, to be fair, in the ER, I get to pretty much bargaining, maybe sometimes grief, but rarely acceptance.
Mm-hmm. Because because if you're with someone for 24 hours, that's
you might
rarity.
See it. Yeah, I don't really take care of them that long. But then with the whole death and the heart rate and how I'm managing this really sick patient, it's probably as accurate as the human centipede.
Okay.
Like, I'd say it's 100%. I don't think it's less accurate than the human centipede because no one's getting their butts done to a mouth. But, no pun intended, there's a lot of things that could be better in this. Just like the human centipede, there's a lot of things that could be done more accurately. I can't believe I justified it. Terrible. So yeah.
All right. Anything specifically you would do to
raise the stakes and make it more accurate?
Yeah. Keep the stakes high, making it more accurate.
Mike Cabbage really kind of nailed it though, with the whole bad intern kind of thing, potentially getting other people sick. I mean, that's the biggest thing that we always kind of harp on our residents is don't do something unless you know how to do it, and don't be afraid to ask for help. And you can tell like Cabbage was trying to impress JD by not wanting to ask for help and trying to do everything by himself, but potentially hurting a lot of people. Mm-hmm. That's always one thing that you'll see with other subspecialties is they'll try to dive head first, not ask for help, and that's how you get people sick. So that's actually a shockingly realistic thing and kind of scary. So you don't really need to change much on that because that's going to keep the stakes pretty high. Whereas for my 5 stages to increase the stakes, I mean, she's septic. You can kind of move things around and have the people moving quickly. Starting an IV is not always a bad thing to do, but kind of showing her sick being brought back in would make it more realistic and kind of hammer the point home. Because really, in that episode, she didn't have that many lines.
Yeah.
Coming in really sick and tired wouldn't have changed anything, really. Because all she said was, I feel cold. And then she hung out on the rooftop beach. And that was really all she did in that whole entire episode, other than lie there with a face mask on. So if they had brought her in septic shock or something, maybe they wouldn't have been able to take her on the beach and Ted wouldn't have been buried in sand, I guess. So that one storyline would have gone. But at least it would paint the gravity of how sick she got because of Cabbage's one mistake. And that's the way to drive it home.
I know that this is likely not something that you see often because, again, in your specialty, you're with patients for hours as opposed to extended period of time. Yeah. And I know that setting up a rooftop beach would be an extreme, but
Yeah.
uh, as far as those little above it, like going into, I think the episode after this one or the one after that, going the extra mile for patients as far as just doing out of the ordinary things like that. Is that something that would happen often, or is that something that people are too overworked to really do a?
It's rare when something that big happens, especially from staff. Like I thought the closest thing I can think of was there was this one kid who posted up trapped in room send pizza.
Mm-hmm.
And everyone on the internet sent them pizza, so it was a lot of coordination of bringing pizza for that one kid. But really, I mean, I'm trying to think when I was a resident, because that's the most I worked inpatient. We didn't do that much. Like sometimes I would go back and visit patients that I liked and just like hung out and talked for a little while. I remember I did wheelchair races one time. But something that above and beyond, that's really tough.
Yeah. Or like JD shaving his head. This was in the episode. I want to say it was 2 episodes later.
That's not an uncommon thing.
Okay.
I've seen a few nurses do that for some patients that they liked. So that's not too uncommon, but building a whole beach and stuff, pretty uncommon.
Mm-hmm.
Yeah. So that, nah.
Yeah.
Also, this is a lady who's who's septic and immunocompromised. Don't take her outside.
Or with buckets of imported sand.
Yeah, that's germs. And especially if it came from like Miami Beach where all those partiers were.
Yeah.
Ugh. No, thank you. You're basically just trying to speed up her death.
Yeah.
Just bury her in that sand already. Honestly, come on.
We'll get dug on that.
Oh yeah.
Anything else? So I've got a couple non-episode questions to ask.
Yeah.
But anything else we want to talk about on
No.
scrubs?
I think I hit all the things that I wanted to hit. My notebook is trash. So yeah,
Cool.
It's all torn up. Yeah.
So just questions that have come up from my family.
Okay.
So we've seen a little bit of, hey, sew mask covers, like cloth mask covers and things like that.
Yeah.
Is that a thing that like hey, you can sew these mask covers and donate them to a hospital?
We're not going to wear them.
You're not going to wear them? Okay.
No. The reason why is I don't know where those are from.
Mm-hmm.
They're not going to work because they will work with or larger particles. But if it's like a COVID patient, that's not going to work.
Mm-hmm.
You need a N95 mask because that actually seals much tighter, especially around the mouth. So odds are we won't wear them in the ER, especially because we're such high risk. Like we appreciate the sentiment quite a bit. But unfortunately, it's good for patients. It's not so healthcare workers.
Okay.
Yeah.
And another question, this was just me talking to my dad before we recorded. So there's one of the things that we saw in Italy was that there's so many patients that they're out of ventilators.
Yep.
Would things like a CPAP or a BiPAP machine be obviously not a solution, but a tool that could be used as a last ditch, we don't have ventilators measure?
So not a pulmonologist or not a respiratory therapist.
Okay.
But the big concern is if you have a patient that's kind of obtunded and not like out of it, really listless, lethargic. I don't want to use the term lethargic because that's almost like comatose.
Mm-hmm.
If you have a patient that's really like tired, not able to control their secretions, nauseous, you don't want to do BiPAP on them because if they throw up, you're going to shove those down. If they have
respirate, yeah,
you're going to shove that down their lungs. The reason why you're using a ventilator is you're basically taking over their whole breathing.
Mm-hmm.
A BiPAP still requires you to take a breath to initiate the pressure.
Okay.
So BiPAP, you're still conscious and able to breathe okay and kind of control your breathing a little bit. A ventilator will take over your breathing completely because we'll put a tube down your throat. The tube is below the vocal cords. We blow up a balloon. That way the air is forced directly into your lungs. And the other part with BiPAP is you're blowing air into your mouth, right?
Mm-hmm.
The air can't decide where to go. It can go down your esophagus. It could go down your throat.
Right.
If it eventually goes down your esophagus enough, it's going to blow up your belly.
Yeah, and could just cause more problems.
And if you blow up your belly, that means
can't-
it's pressure, and then it has to release somehow. You vomit.
Right.
Also, if you blow up your stomach or your intestines enough, you're not going to be able to move your diaphragm.
Right, which is going to make breathing hard. Okay. I figured there would be a reason. I just wanted to know what it was.
Yep, there's your COVID 5 minutes, I guess, on the end of this podcast. Just in this time and age, just double check what your information you're getting. I mean, double check what I'm saying too, just to make sure I'm. But it's so easy to get misled with whatever information you get on social media and all that stuff too. So just double check everything, especially now when everything's really scary and you don't know what's going on. It's really easy to be tricked that you're going to be locked down and the military are going to hold you down, or that this illness isn't as sick or isn't as bad as the people on TV are saying. I mean, I will say this, like in the beginning, I didn't know if it was going to be this bad. I didn't think it would be. And now you can see how bad it was in Italy and that we are slowly lagging behind.
Yeah.
Or not closely lagging behind, I should say. So double check all the information out there. Don't be fooled by what you hear all the time. Just get it from reputable sources. That's the most important thing. That will be the medical advice that even we say we don't get medical advice, that will be my medical advice. That and wash your hands, and if you really can, stay at home. Like, just think about grandma. Think about grandma and grandpa. Just stay home. Keep them safe, because when you visit them, they might get what you get. So just stay home. Keep them safe. That's the
And which essential oil do you recommend?
So, you know what's funny? I went to the store and the acetaminophen's gone, ibuprofen's mostly gone, emergency all gone. Essential oils, so much.
America, I love you.
Yeah, just stop it. The fact that there's no emergency shortage of essential oils should give you a good idea about the efficacy of essential oils.
That is the most hopeful thing for our country I've heard in a long time.
Yeah. Remember, essential oils doesn't mean you need it. It's just the essence of whatever you're using. I don't think people realize that. And someone offered that to me at work the other day. It's like, oh, you look like you're feeling tired. Here's some essential oils. I'm like, get that out of my face. Like, I don't want this. This is terrible. I also don't want to be part of your MLM. Get that out. I don't need that. I'm good. I don't need more loans. I got student loans. I don't need more than that. We're good. Thank you.
All right. With that, I think that next week or next episode, we're going to record on the possibly more consistent schedule, since we don't have to haul a microphone back and forth. Who knows? But next time you hear us, it's going to be something more lighthearted and less related to COVID. But I know, Jackson, you really wanted to.
I want to do something real stupid.
Yeah.
So that's what we're going to do next time, is something real dumb. And
okay.
Real fun, because that's the root of this podcast.
Yeah.
Is really stupid stuff.
You haven't had the chance to get angry at the television for this episode for this podcast in a long time, and I'm sorry that our national emergency has deprived you of that.
I know the bastards, a stupid virus. I just want to be angry about silly stuff again, and that's what we're going to try to do and try to return to normalcy. So yeah, I think good talk. I think, remember, follow us on all the social media, and then if you get a chance and you listen to this podcast, rate us on Apple Podcasts.
And tell your friends.
Tell your friends. It'll help us quite a bit just to spread the word. I think
have a listening party over Zoom.
Yes, and then you can talk about how stupid we are in chat. That'll work too. That'll be perfect. I hate Zoom, by the way. That thing is the worst thing in the world. That's how most of my meetings are being held right now. I hate Zoom. It sucks. My wife will tell you the same thing. So.
All right.
Okay.
All right. Well, Jackson, you and I will talk soon. Everyone else, you will hear us talk soon. And thank you for listening. Stay safe, everybody. Wash your hands.
Yep. Stay safe. Bye.
Bye.